I want to turn now here on Power and Politics to Dr. David Naylor, who is the co-chair of Canada's Immunity Task Force. He's also a professor and president emeritus at the University of Toronto, and he is in Toronto. Dr. Naylor, as we hear about, I'm going to try to parcel off the different pieces here and talk to you about that. First, let's talk about the new countries that are being added to the travel ban list. So Egypt, Malawi, and Nigeria. Canadian citizens coming back must be allowed back in. That's the way the laws of the land work. But foreign nationals traveling to Canada from those countries or who have been in those countries in the last 2 weeks, as well as the 7 countries that were previously announced, there is a ban in place. Bans have been criticized by some. From your perspective, are they helpful?
They may be helpful for the very short term only, David. They certainly lose a lot of friends. I look at the list of countries, and Nigeria had a travel ban against South Africa until October 14th. That's going to be forgotten pretty quickly now. You're going to see a pretty strong Pan-African backlash against this ban. So that's part of the reality. Why do I have mixed feelings about them? In general, this virus, like other variants, is going to spread pretty quickly. So you may buy a little time by targeting a few countries, but what really matters is the efficiency and effectiveness of your broader border measures. In that sense, the other measures announced today make some sense. You can toggle those measures a bit to focus on a few areas of higher concern. So that's baked into the idea that there would be more official quarantine rather than going to off-site, that you would be under supervision, as it were, for the 10 countries. And that kind of measure, together with more testing, might be more palatable and more in the spirit of the global nature of the fight against COVID-19.
Let's go through, you allude to some of the other measures that are being talked about. So arrivals testing is one it will in short order be all travelers except for those coming back from the United States. Don't have all the practicalities of it straightened away just yet, but essentially you land at an airport, you come through a land border crossing, and you got to get a test on arrival, a test the government will pay for. Your thoughts on implementing that now?
I think it's important to go ahead with testing of everybody. I think that's the right way forward. I think the pre-departure or pre-arrival testing, sustaining that is sensible and appropriate. And I think we're going to have to really be on our A game in terms of getting this implemented quickly. The reality, David, is that there's been traffic from those countries into Canada for some number of weeks until now. So it's unclear, just how much quiet community spread may already have seeded. Mm-hmm. But the broad testing is appropriate because, as many have noticed, these cases are popping up all over the place. It's just a matter of time until there is community transmission. We're no longer able to link them to travel. That's the way these variants go. So all these measures are in many ways an effort to buy time so we can get better prepared and, above all, learn a lot more about this variant, because Omicron is still in many ways a mystery. There's a lot we don't know about this particular variant.
Yeah, and I take your point. 2 weeks ago, nobody knew about this thing, and now we're fixated on it. So let me ask you, you said earlier that Omicron, this variant, as variants go, will eventually be dominant. How do we know that?
I said it will spread widely.
Excuse me.
The question of dominance depends on infectivity.
Okay.
So let's go back to the questions of where we end up with these variants. The things you watch for are infectivity. And if this particular variant is more infective than Delta, then it will, in fact, become dominant over time. We don't know that yet, although it's suspicious looking at the data from South Africa. But of course, what also matters is virulence. And so if someone is infected, how sick do they get? That's still unclear. And then the thing that links them both, David, is response to immune measures. So think of this on a sort of spectrum, where at one end you have people who are unvaccinated, have never been infected. What's the vulnerability there? Probably high. Then people who have been infected but not vaccinated, tragically common in lesser resource countries. How do they fare? And the data from South Africa suggests that many of them are getting infected. And then we turn from there to look at the individuals who've been fully vaccinated with effective vaccines. How many breakthroughs are occurring? And you're back to a matrix here where one thing to be infected, but we've often seen that these vaccines may not be as effective at preventing infection, but they're really good at preventing serious disease. So the real gold standard here in many ways is, do the vaccines prevent serious disease, hospitalization, ICU admissions, and deaths? If that happens, if they're still holding up, then we'll be in a much better position to deal with this variant. But there is considerable concern about reduced immune protection against this particular variant. And that's what everyone is watching. That's why there is such a strong reaction, given the number of mutations in the spike protein of this variant.
We've got about a minute left with you, Dr. Naylor. About 87% of Canadian adults are fully vaccinated. A number of them are planning to go away, to get on airplanes over the holiday season, coming up about not even a month from now.
Yeah.
What would you suggest they start thinking about?
I can simply tell you, David, that I won't be getting on any airplanes to go anywhere right now. This is a pretty difficult time to be zooming out and about in the world. Obviously, people will need to be cautious over the whole of the holiday period. Gatherings need to be done with people who are part of your bubble. I think we need to be on a sort of precautionary principle throughout the next month or so until we know more about this particular variant. And for the rest, very important to follow all the sensible measures, no matter where you are. Mask effectively. Wear a medical mask with a cloth mask over, or get a good N95 respirator or its equivalent. Make sure you keep your social distance if you can when you're outside with strangers. Avoid spaces that aren't well ventilated. Keep your ventilation in good shape if you're indoors. All the usual measures. They still work. They're going to work against this variant. And just be on your guard for the next few weeks. No need for panic, but cause for concern and caution in the weeks ahead until we know more.
Dr. Naylor, as always, very good to get your thoughts. Thank you.
A pleasure, sir.
All right, turning back to our top story and the new measures announced by the federal government to fight the spread of the Omicron variant in Canada. The travel ban now includes 10 nations, all of them in Africa, and testing upon arrival when people land or cross the land border, coming back for anyone entering the country, with certain exceptions, notably those traveling from the United States. Marco Mendicino is the Minister of Public Safety, and he is in Ottawa. Minister, thank you very much for joining the program. I know a very busy day for you. So, perhaps you can take me through some of the traveler components to this. Beyond just the measures that you're announcing, what would you say to the many Canadians who, for business or pleasure or for the holidays, are looking at plane tickets out of this country and returning over the next month?
Well, the first thing I want to do is begin by reassuring all Canadians that we are introducing the necessary public health care measures to protect all Canadians from this new variant of concern, the Omicron variant. Just to unpack a little bit about what those measures are, we will add, as you pointed out at the top, to the list of countries of concern. It's including Nigeria, Malawi, as well as Egypt. That is all informed by the best available evidence, which we continue to receive from our public health care officials in real time. We're also going to introduce, as you pointed out, some mandatory testing at the border, including requiring all travelers on all flights to submit to on-arrival testing. That testing will be provided by the Government of Canada, with the exception of those arriving from the United States. So these are prudent measures. They're responsible measures. As is always the case, we will continue to rely on the evidence that we're getting from our public health care experts. I'll also just point out that even as we speak, we're meeting with our provincial and territorial partners to ensure that we are doing everything that we can domestically to manage community transmission, because we know that that is very much part of the equation. And the last thing that I'll say is the most important message we can deliver is to encourage all Canadians to get vaccinated. That is the first and best line of defense against the pandemic, and we will continue to follow that advice and encourage Canadians to do that.
Okay, so let me break this down. So first of all, for those Canadians who are planning to travel out of this country or who are currently out of this country, we've heard a number of ministers, some at the provincial level, saying things could change rapidly and things could get more restrictive. Is that possible in your mind?
Well, I think the best advice we can offer everyone is to continue to watch the advice that is coming from the government, as informed by the evidence and the science and the research that is being provided to us from our healthcare officials. What we have done today is we have introduced the public healthcare measures at the border to give ourselves some additional time to learn more about the Omicron variant, to be sure, for example, that we understand whether or not it is more transmissible, to be sure that we can understand whether or not it potentially carries with it additional negative consequences and symptoms. And finally, most importantly, to be sure that we're getting the best advice as to whether or not the vaccines that we have currently in force and are encouraging other Canadians to take up are effective at resisting that variant. So that's what these measures do today. It's important that Canadians follow that advice and, of course, use that advice to inform their travel plans. And if there are any updates, then we will provide them.
Okay, so for people who are traveling and are coming from one of the 10 countries that are on that travel ban list, Canadian citizens, of course, can always return to the country. What does it look like? They land at an airport and then they get a test at the airport and have to go off to a quarantine hotel? How does it work?
Well, I think that's a very good question. So if you are a Canadian or another person who has a right of return to Canada, then you are no longer able to use a pre-departure PCR test from one of those countries if that's where you obtained it. You will now have to stop in a third country to acquire a PCR test there, a negative PCR test there, to be precise. Then once you arrive at the border, you will be required to take an additional PCR test where you will then have to quarantine until you get that result back. Now, if the result is negative, then you will be able to carry on to your final destination or to your home. And for everybody else, for all other travelers outside of those who are either coming from a country of listed concern or who have transited through a country of listed concern, you will still have to provide both a negative PCR test as well as submit to an on-arrival PCR test, but you will not have to quarantine as long as you have a suitable place where you can isolate. So, for example, your home, but you will have to provide that negative PCR test result within 24 hours. Otherwise, there will be enforcement consequences, including very hefty fines. And this is a government that will not shy away from imposing those fines that are necessary. We need these measures in place, again, to continue to buy ourselves the time that is necessary to learn everything that we have to learn about this new variant of concern. We need to take it very seriously, but I want to reassure all Canadians that the measures that we put in place at the border are there for their protection and safety.
Let's talk about that travel ban. 10 countries, all of them in Africa. Not all of them have reported cases of the Omicron variant. Canada has. Is your government concerned that Canada could itself end up on a travel ban list of some other country, given that we're the ones reporting cases?
Well, the good news, David, is that we have always put into place rigorous healthcare measures at the border to manage the pandemic. And today is no different. It is consistent with the approach that we have taken, always receiving and informing our decisions by the best available public healthcare advice, which is why we are taking the approach that we have around travel restrictions, around putting in place additional mandatory testing requirements on arrival at the border, and yes, where you have transited through or are originating from one of those listed countries to submit to a quarantine pending the result of your negative PCR test. So together, we're confident that these measures are a way, again, to provide us with that additional cushion and some additional time while we learn more about the variant of concern. We all want to be able to celebrate. Holiday season is upon us. I totally get that. And the best way to preserve those opportunities and to ensure that we can all celebrate is by following the advice that we get from our public health care experts and by putting in place the measures that are necessary to keep us all safe.
Okay, I know you've got to go. I've only got a minute with you left, but I do want to ask you, most Canadians who do travel are traveling from the United States. And right now, the measures you've announced do not require arrival testing to those coming from the United States. Do you anticipate that will change? Because as I understand it, the reason that there isn't arrival testing at this point is more a capacity issue, the capacity to do those PCR tests on arrival. Do you anticipate that that will change in the coming days or weeks?
Well, I just want to make it abundantly clear to your viewers and all Canadians that we will spare no expense when it comes to putting in place the resources that are necessary to protect Canadians, whether it's at our borders or working in conjunction with our provincial and territorial partners. And so that I just want to be absolutely clear about. But I also want to say that when it comes to taking the decisions that are necessary at the border, that we continue to receive advice in real time from our public health care experts. We're working very closely with our American counterparts on the issue of the movement of people across the borders, in particular around the border towns. But we have to place the health and safety of Canadians as our paramount concerns. And equally, we want to preserve and protect all of the progress that we have made, which is in large part
Minister, I'm just going to jump in on you. I know I said it was the last question, but I've got to ask, could arrival testing come to those crossing the land border from the United States? Is that potentially on the table?
Well, I just want to clarify that we do have already in place mandatory randomized testing for some who come at the land ports of entry as a way of protection. But we will continue to follow the advice that we get from our public health care experts, and we will do that to protect the progress that we have made with regards to managing this pandemic.
All right. Minister Mendicino, thank you very much for your time this afternoon. A busy evening for you, I know.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.